Hello guys, this is Dr. Palaniappan Manickam. I got infected with COVID. I was down for the last couple of weeks. I'm here to tell you the lessons that I learned from my experience in this video. Let's dive deep into it. Maybe not so deep, maybe superficial for now because heart konjam valikkudu. So since we have been extremely busy at home, raising 2 kids with my full-time work, we thought we will take a break. We go to a resort and kids had the time of their life in the first 2 to 3 days. At that time, I thought about myself. I was like, how come things are happening so good in your life? Something should have happened. And right when I was thinking, I started running a fever. So I knew that it is going to be COVID because this trip was supposed to happen in January as a part of our 10th anniversary. We decided to postpone it because the Omicron infections were so high in January. But now since the cases are going down, we thought, okay, we'll take this risk. But I know that this is going to be COVID even before the fever came. So I tested positive in the resort and they put me in a quarantine for 5 days in a separate room. I had all kinds of symptoms: nausea, vomiting, abdominal pain, fever, headache, dizziness, and shivering. Was like, why did you exclude me? I was like, please come. That's also. For the first 5 days, I felt so sick that I was completely bedbound. They used to keep a Gatorade bottle right outside the room. I didn't even have the strength to get up from the bed, open the door and get the Gatorade bottle. I was so dehydrated. There was no oral food intake at all. All I was drinking was just sips of water. So with Tylenol to the rescue, I was able to get better after 5 days. I took so much Tylenol that paracetamol and the Tylenol would be like, why are you taking me in paragraph? Just take me in single sentences. Since the fever was continuous around 39 degrees Celsius, I took paracetamol so much that paracetamol was begging me, please leave me alone. Nalla para eduthen paracetamol. I'm just reminding that if you get into the situation, don't take more than 4,000 milligrams of paracetamol, which is 4 grams. If it is 500 milligram tablets, you could take up to 8 tablets per day. So my family got exposed. They tested negative. My kids had some mild symptoms and they got better. And they were thinking that I'm having the time of my life in the quarantine room. Only I know that COVID is having the time of its life in me. So after the 4th day, 5th day, I started feeling a little bit better. I got my energy back. I started eating solid food slowly. And then I actually came back to normal completely on the 9th and 10th day. On day 11, I started having some shortness of breath and some chest pain. And I was concerned. I went to the emergency room, got a CT scan done, which shows that 90% of my lungs are completely wiped out. Remember this story. You get better in the first 5 days and then it hits you after the cytokine storm. April, May 2021, Delta variant, India, lots of fatalities. The same story. So then they put me on dexamethasone. The steroids helped me a lot. I started feeling slowly better. Even now I have some mild shortness of breath and fatigue, but overall I'm feeling much better. So this video I'm going to share the points that I learned from this experience and the things to take home so that we can be prepared for any kind of future COVID wave if it happens. So number 1, even when there were peak COVID case rates here in my hospital while I was actively seeing COVID patients, I was not infected with COVID at all, probably because my immunity was very high with the vaccination. And with the vaccination titers going down, given that I got my booster dose in September 2021, which is almost 9 months. Multiple research studies have shown that your immunity weans off after 6 to 9 months. So it will protect you from severity of the infection, but might not protect you against the getting the infection to start with. So lesson number 2, I still believe that even though my disease was bad, I did not end up in ICU because of my vaccination status. Even though the titers were weaning down, it was good enough to protect me from going into the ICU, which is the most important advantage of a vaccination. So number 3, why did I get severe symptoms? Why did I get all these problems despite being vaccination? Again, emphasizing the point that vaccine doesn't prevent you from getting an infection. But I have 2 theories why this might be so severe in me. Number one, I do have allergic rhinitis, which means I have some upper respiratory problem to start with. I use some inhaled steroids intermittently during allergic reasons. Even though people say that multiple comorbidities like diabetes, hypertension might be the problem to think about for severe illness in COVID, I think personally that any kind of respiratory problem, it could be allergic rhinitis or asthma, you are at increased risk of severe symptoms, and the damage could be a little bit severe. And the second thing, I strongly think that this could be a factor as well, is that because my body fat percentage, if you calculate my body fat percentage, it was around 24 to 25%. Even though I don't look obese, I am not strong enough. I have explained that to you in my previous videos. I have a strong feeling that this might have to do something with the severity of the symptoms. Yes, some patients are very lucky that, even though they are not very healthy, their symptoms are very mild. But if your body fat percentage is high, it definitely puts you at a risk of severe symptoms as well. And lesson number 5 is, even though Omicron is the dominant variant these days, Delta variant is still not gone. My symptoms, my progress of the disease was exactly similar to how Delta variant usually presents. Unfortunately, we couldn't sequence my virus strain, but most likely this is going to be Delta. Given that I got vaccinated, I got escaped. So given that the titers are going down, it is even more important to consider a booster dose so that we can maintain the titers up. So what I want from you guys, number one, COVID is still not gone. I know that this is a very pessimistic view, but it is what it is. It is the reality. We need to adjust ourselves to make sure that strong enough to combat the virus in any way possible. So given that the titers are going down after 6 to 9 months, if your last dose was more than 9 months ago, please get a booster dose as soon as possible. Number 2, if you are in India, it is okay to take either Covishield or Covaxin or Sputnik, whatever vaccine is available to you, all patients more than 18 years of age. There is a small uptick of COVID cases now in India. This might be the right time to protect yourself. If you're outside India, if you have access to mRNA vaccines like Pfizer or Moderna, it is even more clear that these vaccines have lower duration of efficacy compared to Covishield, given that this is an mRNA vaccine. So it is even more important to protect yourself from a booster dose. In US, the criteria is only for age more than 50 years old, but you can be creative to get your booster dose done. And number 3, people are very sick and tired about this long 2-year COVID hiatus, and people are planning for travel to India, travel to US, back and forth. I think you should not let your guard off now. Be a little bit more vigilant. Try to wear a mask in an indoor setting for sure. Get your booster dose done. I'm not saying not to travel, but travel with a little bit of caution. And again, after getting the booster dose, measure your waist circumference as well. If it is more than 90 centimeters in men and more than 80 centimeters in women, which is the criteria for possible overweight. If it's more than 100 centimeters in men, it is considered as obese. So even if your waist circumference is more than 90 centimeters, which is what is happening with me, your symptoms can be a little bit more severe in case if you get exposed to COVID. So you have some time to work on that. Follow my previous intermittent fasting videos. I'm pretty sure that COVID would have thought that this guy is talking too much about me. Let me show the real face. After seeing that face, I surrender with grace so that my life still have some trace. So bottom line is, number 1, get your booster dose done. Number 2, follow intermittent fasting and improve your immunity. With these 2 things, you can make sure that even if you get COVID, it is going to be a mild one, so that you don't have to worry too much about it. I have vented out my experience in a Tamil video as well. Please check that out. Remember, stay safe, get vaccinated, one belly at a time. It is absolutely important. I'll see you in the next video. Bye.